I've struggled with this my whole life. It just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
So once again, this is Dr. Jonathan Lebowitz at the Long Island Gynecomastia Center, Long Island VaserLipo Center. So today it's Monday. Is it Monday? It's Monday in September. And I got this great gentleman who flew in from Dubai, Middle East, for my gynecomastia expertise. And it's really not that bad as you know, my patients go. He can lose a little weight, as most of us can, but what he concerns himself about, is tormented about, and guys are tormented about this for you know, since teenage years, is that the non-shape of their chest and also the fullness of this. He's not in his teens anymore, so he's got gland and fat here. Gland and fat here, probably fibrofatty. He's got some hardness, rubbery gland there, but mostly fibrofatty. So my goal here is to really flatten him out perfectly here, create a negative space at the lateral and inferior aspect of the pectoralis major muscle, as well as back here to the lats. As I mention all the time, it's just as important to take care of this area as it is ground zero, this area underneath the nipple, and obviously on both sides. Stealth incisions, once again, armpit, and at the very end of my operation right here to pluck out the gland. I'll sculpt, contour, liposculpt, lipo contour his chest to perfection, negative space between the lateral aspect of the pecs and the anterior aspect of the latissimus dorsi muscle, and go down here to his upper abdomen, give him that deltopectoral groove that we all like, give him that rhomboid shape over here in the middle that we all like, and he will be perfect. So now we're just doing the numbing, and right now it's just pressure. Vaser works on steam heat, so you need a wet environment. And we're going to start with that stealth incision. So as I said, just as important to get right here, laterally, scoop this negative space out there so you get beautiful definition of the pectoralis muscle over here and the latissimus dorsi. 5 ringy dingies.
1 ringy dingy. 2 ringy ding. Oh, a gracious good afternoon, Mr. Beadle.
Delto. Pectoral groove. And 5 ringy dingies. The drill. These are my curved cannulas, and this gets right around here, so it does all that stuff. This is Lucille, and she is awesome.
This is Lucille, and she is awesome.
So this really kind of scrapes the undersurface of that gland. And this is gonna kind of fine tune the deltopectoral grooving. Make sure everything's perfect and there's no blood vessels, you know, trapping us up there. And that's it.